Thank you very much for this kind invitation to this wonderful meeting. I'm happy to contribute on remote, but I would like to be there for the next year. Thank you very much, Dr. Cardoso, Dr. Natalia Cardoso, for this kind invitation. Let me share with you this short presentation about sclerotherapy of the dorsal hands on the hand. With the on the face, the veins in the hands are the ones that most anticipate aging, and patients sometimes request vein treatment. This is a real world. How is it done? We don't have one protocol. We have as many protocols as surgeons we are. We need some previous experience with sclerotherapy in legs and spiders. It's required, in my opinion. And the dorsal vein on the hand's anatomy is very important because we have four digital veins per finger. We have palmar and dorsal arches with a multitude of connections. We have the metacarpal phalangeal venous plexus, and we have also metacarpal veins and dorsal venous arch that each must be treated, but we do not to treat the metacarpal phalangeal venous plexus. The technique of the puncture is it looks simple due to the size of the veins and it is, of course. However, these veins are more mobile, and so inaccurate punctures are more common than we might initially expect when we are going to perform the procedure. In my opinion, we must inject in a slightly palmar flexion with just enough to fill the vein and allow it to be punctured. And don't forget, do not treat the metacarpal phalangeal plexus. No way, because this is dangerous because it's surrounded with a lot of small arteries. Hold the patient's hand with ours and at the same time stretch the skin to fix the vein. And the needle landed with an angle of 15 degrees to have a suitable entry angle. It's my recommendation. This is some examples of how I perform the technique. It's very easy, very simple, and we can treat the cephalic part of the hand, or the basilic part of the hand. I recommend to treat one part and in the next session the other because it's not complicated. We don't have very much complications of this, but it's to avoid small amounts of small thrombus, sclerosis, and it's disturbing for the patient. We can treat any vein, the dorsal part of the hand, without any danger, real danger, if we follow the rules. The rules, as I said, don't inject in the metacarpal phalangeal place because only we have some reports about injecting in that part and some intraarterial inadvertent injection occurred. This is we must slightly and distribute the foam, and we have very good cosmetic results with this technique. Let me show you some technique pearls. I use wet foam, the ratio 1:3, no 1:4, like in 3%, 1:3, even less. Rise the hand immediately to empty the vein and do not aspire, because in the middle of the movements you can lose the vein. I am one of the luckiest guy on the earth. This is a picture taken 2 months ago in Córdoba, in Spain.